What are the different types of contraception? To talk to you about this, I'm here today, Dr. Sonal Kumta, speaking from Fortis Hospital, Mulund. Contraception is for prevention of pregnancy, as you all know. We follow what is called a cafeteria approach for contraception. What does this mean? As a gynecologist, as a doctor, I tell my patients about all the different options that are available to her so that she can choose and have contraception. Let's start with the barrier methods. As you know, the condom is used by the male and a diaphragm can be used by a female. Now, a barrier method, in addition to giving contraception, also prevents sexually transmitted infections. So it is an excellent method of contraception. But mind you, the efficacy is about 70 to 80%. Means if you want sure shot contraception, then it is better you club this with another method of contraception. Let's move to the second group, which could be the intrauterine devices. As the name suggests, intrauterine device is a physical device that sits inside your uterus. Normally, it could be a copper containing one or it could be a hormone containing one. What does the intrauterine device do? Well, it physically sits inside the uterus and it does not allow the pregnancy to happen. So this is the second group. Then there are birth control pills, or which are commonly called as oral contraceptive pills. These have certain hormones in them. And what does the hormone do? It does not allow your egg to grow, or it suppresses ovulation and hence prevents a pregnancy. But these medications, they need to be used with caution because they contain hormones. The fourth group will include injectable hormonal preparations. There are once a month injections available and there are also 3 monthly injections available. These can be used by women very comfortably because they need to just come to the hospital once and get the hormonal shot. At this point, let me also tell you something which is called as emergency contraceptive. Well, the name itself, emergency, means it should be used in an emergency setting and should not be used regularly as a contraceptive method. Emergency contraceptive are a couple of pills. They are tablets which need to be consumed by the woman if there is an unprotected intercourse or unprotected sex, and she needs to take it at the earliest and at least within 72 hours of having sex. These are easily available and they can be procured over the counter also. That means you need not have to go to a doctor to take the emergency contraceptive. But mind you, this is an emergency method and it should not be used regularly. Well, there are also permanent methods of contraception in which a woman can choose to do a surgery which is called as a tubectomy, which can be done laparoscopically also, or her partner may choose to do vasectomy, that is tying of the sperm cord, and these are surgical methods. They are permanent methods and they should be used only when you have completed your family and you have made that final decision that you don't want to have any more children. So I hope this information that I have given is useful to you and you will be empowered to make a correct choice for contraception.